My role as an infection prevention and control nurse started over 20 years ago, and I was very fortunate to work in the acute hospital setting for 10 years, and for the rest of the time I'm an independent practitioner. But in both areas it gave me an opportunity to inform management, so make sure that they knew about all of our guidelines and policies. Then it gave me the opportunity to promote our best practices, both in the acute hospitals and now also in the community setting, where we have patient care in their own homes now. So it's really, really important that our principles of infection prevention and control are the same, whether we're in the acute hospital or the community, and those are challenges. But we also have to help our staff to sustain the really, really good practices they have. Some of them are old, they're as old as Methuselah, old as myself and maybe older, but they're still good and they work.
Being involved in infection control has given me a much broader view of the whole organisation, meeting different people at all levels of the organisation, affecting the care of many different patient groups throughout the organisation, meeting patients and their families, giving them appropriate information and supporting staff at all levels of the organisation. So from that point of view, it's a very fulfilling role.
One of the things that's the best thing about the Irish branch, really, and I think anyone else will tell us the same thing, is that we all have fun together. Whilst there's a serious side to us, there's a fairly serious side about all the work that we have to do and the commitments and all the various things, but we actually all have fun. We're not just colleagues, but a lot of us are lifelong friends, and we get on really, really well together, and I think everyone's good in that way.
It's true, the link that we have helps us all to cut down on the stress, because life nowadays is difficult enough, but the fact that some of us are at it a long time, others are newer and very much welcome to the group, then we can all work together, because we go from being a novice to hopefully an expert at some stage.
I think the society is very important for two reasons. One, I think it has at the heart a focus on patient experience, patient outcome, and ensuring that everything that happens to patients when they're poorly means that they're not harmed by what we do to them. I think another thing that's really important is the way in which we support practitioners within the specialty to maintain their competence, challenge practice, behave as if they are very, very strong professionals with a passion for what they do.
There's a whole lot of support in the group, and we're all coming from different backgrounds. We've community people, we've people in the acute sector, we've people specialising in different areas, so we all chip in and help each other out, and we're always at the other end of the phone for people.
Yeah, and that's what I love about it, that if you're on your own on a day, you know, when something comes up, you can pick up the phone and you get the answer within minutes. So,
and there's always going to be somebody who's dealt with the patient at the end of the day that has the problem that we're dealing with today. They've dealt with it tomorrow. And it is all about being central to caring for that patient, because that person is somebody's mother, father, brother, sister, and we want to make sure if it's mine, I want the best.
There's a huge diversity within infection prevention and control. We cover everything from the spectrum of community services with disabilities and home caring, the education of patients and staff, visitors as well and their families, and huge geographical areas within the community sector. We cover then the acute sector, so we have people who are coming in who are acutely ill, whether it may be with an infection, or people who are concerned, who are worried. We have families who are scared, patients who are scared, staff who need education, patients who need education. It's a hugely diverse job.